Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Our program focuses on healthcare issues relevant to you and your family. We have physicians and healthcare providers on the program that give you more information about things that might be of interest. So I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Katie Brown. Thanks for being on the show again,
Thanks
Katie.
for having me.
You were one of my first guests when we first started doing this show.
I absolutely was.
So it's good to have you back on, and we're going to talk about some exciting new programs that we have here now at KRMC. To start with, I'm holding these little samples here. They're so cute. I can't believe how little they are. Because I can remember my grandfather, a couple of years ago now, but his first hearing aids was just this gigantic thing that I think he had to wear in his pocket.
Yeah.
And had a wire going up to his ear. And then it got big on his ear, and it whistled all the time.
Hearing aids have come a long way from a large body worn device to a lot smaller, more discreet devices that are barely visible when they're worn on or behind your ear.
Right, I was going to say, and they're colored. Look at how pretty they're purple.
Yep,
it
matches your
matches
shirt.
my shirt. Color coded just for me. So if I put it on there, it would almost look like an earring, right?
Absolutely. They do make them more decorative than before, or if you don't want them to be decorative, you just want them to be kind of hide away behind your ear. They do that too. And all different sizes are available because not necessarily every person is going to need or want a very small device because they may have manual dexterity issues.
Oh, to be able to get their fingers working good enough to put it in.
Yeah, because the smaller the device, the smaller the battery, and sometimes people can't manage the smallest size batteries, so we would want something a little bit larger. But if aesthetics is the primary concern for somebody, there are devices now, hearing aids, that can more than accommodate most people's need for discreetness with their hearing aids.
Yeah, if they're self-conscious about it.
Absolutely.
But obviously, like you said, it's not for everyone, and so you have a wide range that they can choose from.
Absolutely.
Right.
We have hearing aids that can fit the most mild of hearing losses or the most profound of hearing losses. Not every person is a hearing aid candidate, but for someone who is a candidate for hearing aids, we do have hearing aids that can fit the full gamut of hearing losses and listening needs.
So how do you determine what their level of hearing loss is and if they need a hearing aid or not?
Yep. So if somebody is interested in hearing aids or they just feel they have a hearing loss, we go through a full diagnostic hearing evaluation. And that starts with a case history questioning that I perform with the patient to figure out when the hearing loss started, if it was progressive, if there are any issues such as ringing in the ears or pain in the ear or things like that. And then we do the diagnostic evaluation that will tell us the degree, configuration, and the place of hearing loss within the ear. And then once we find out that information, we talk about what I call listening lifestyle. And those are the environments that a particular person is in where they need to be hearing well. And then from there, we can prescribe an adequate style and technology level for a particular person.
I had no idea. I thought you either needed a hearing aid or you didn't.
Yep, it's not as black and white as that, but
it isn't.
But a lot goes into the determination of if somebody is a candidate and how well they'll benefit from hearing aids.
So do these new little ones like this, do they still have that ringing? Do they make that buzzing?
That's a good question. All hearing aids can whistle. Because it's when you are putting noise into a small tube, which is what your ear canal is, some of the sound will leak out. And when that sound leaks out and goes back through the microphone of the hearing aid, that causes that that whistle. So it really depends on a lot of things. One is how plugged up the ear canal is, the severity of the hearing loss, which predicts how much amplification there will be. And how far away the microphone is from the sound source on the hearing aid.
So like this, sorry, I'm not real good here. So this is the part that goes in your ear. It's pretty little. This is the part that then goes from your ear to, is this where the microphone is?
Yep, so the microphone is actually housed in this purple part of this device.
And the battery goes in there too?
Yes.
Wow. It's obviously really little.
There's a lot in that little
Can it come
house.
apart?
It doesn't come apart.
Oh,
It's just
okay.
a dummy hearing aid. But,
Oh, okay.
But a real hearing aid would open up and the battery would be able to be inserted. But for the purpose of demonstration,
Sure,
it's
okay.
just a plastic housing.
Well, it wouldn't show well on camera anyway because it's already so little.
It
I
is
can't even
teeny.
imagine how little it is inside that thing. You need a microscope. And like this one is a little different.
Yeah.
Because it's got that little silver piece on the back. What does that do?
There are some hearing aids that have a button on them, and that button is used to access different features of the device. On that particular device, the button can be programmed either for a volume control to adjust volume, just like on
Oh.
the TV, or it can be used as a program button. And hearing aids can be programmed to have different listening programs or listening.
So like a station, like if I want to listen to country versus hard rock? No.
What we would use a different listening program for is if someone is in a particular situation. I use the example, an orchestra player. Somebody plays the violin in an orchestra.
Uh-huh.
They will need sound to be amplified differently than the speech spectrum. And so they may have a program that's specific to music versus speech that they would push the button and go to.
And then they can go back to when they're out
Exactly.
just
They can
walking
go to
around
their
or the
normal.
reception afterwards where they're talking.
Yes.
And they can switch it back. That's pretty cool.
And a lot of older hearing aids, that button was to access the noise program. So when you were in quiet, the hearing aid would function a particular way. When you got into noise, you would have to push the button to access your noise program that helps you hear better in noise. Now they do that automatically. So that button isn't as necessary as it was in older hearing aids.
Because I do know some folks that have an older version of a hearing aid, and they still, even with their hearing aid, have a challenge if they're in a group
Yes.
setting, like at a party, reception, whatever. And there's a lot of people talking, and even like this close, there's so much background noise that they're not able to always hear.
That's correct. Background noise does pose a difficulty for anyone with a hearing loss, and that does not get completely fixed with hearing aids.
Oh,
So
okay.
hearing aids are just an aid, and even the best levels of technology in hearing aids, you're not going to hear everything.
Okay.
And just think how you and I communicate in noise. We don't
Right.
pick up everything.
Sure, right.
And so someone with a hearing aid isn't going to hear everything in noise either.
Okay.
But it makes it better than listening with a hearing loss.
Sure, okay. Well, I'm going to have to tell my friends, though, to go and see you.
Absolutely. I'd be happy to see them.
These hearing aids keep wanting to play with each other. I know you told me before the show that they've got magnets in them. So
They do.
They jump off and they want to go play. It's too funny. So a person that is thinking that they're having some hearing issues, probably their wife or their husband is telling them
Yes.
that they're having some hearing
I
issues.
hear that very often.
So then, do they need a referral to come and see you to get their
Yes.
hearing tested?
So even if your insurance company doesn't require a referral for diagnostic hearing testing, we do require one through our clinic. And so
Okay.
it would be the patient's responsibility to contact their primary care provider
Okay.
or their ear, nose, and throat physician and get a referral to our clinic for a diagnostic hearing evaluation.
Okay.
So that we can talk more about what hearing aids would be most appropriate.
Okay.
And if hearing aids are appropriate.
Right. So, like you said, they're not for everyone. What would be an example of someone where it's not appropriate, where a hearing aid wouldn't?
There are a
be
couple of different things that I'm thinking. One is if somebody comes into my clinic and says that they've had a sudden loss of hearing, and I do an exam where I just look in the ears first. If their ears are completely plugged up with wax,
Oh.
so we wouldn't fit a hearing aid on them. We
Right.
would want their ears cleaned out.
Okay. Now, do you do that, or do they go back to?
I can do some minimal wax management,
Okay.
but if it's deep in there or if it's impacted from the use of Q-tips, then I usually do recommend follow-up with either the primary care doctor or an ear, nose, and throat physician to get it out.
And you said Q-tips. So using Q-tips can cause that problem?
Using Q-tips can impact waxing your ear, that's correct.
Oh.
Wax is naturally supposed to work its way out of the ear, and what happens is when you're using a Q-tip, you're shoving it into that wax, and it can sometimes make a wall of wax that can shut off your hearing. And then, of course, once the wax is extracted, that can restore hearing back
And
to
it's
what
all
it
of a
was
sudden,
before
oh,
the
wow,
wax was
look at
there.
that. That's
Exactly.
pretty cool. Hadn't even thought about that.
Yes.
So that's good to know.
And there are other things, like if you had, for example, middle ear fluid. So kiddos get middle ear fluid quite
like
often.
swimmer's ear, is that
That's
similar or
actually an
different?
outer ear infection.
okay.
But middle ear fluid is when you have an infection in your middle ear behind your eardrum, and what happens is your middle ear fills up with fluid. That fluid gets infected, and then sound can't transduce as effectively through the ear system.
Sure, makes
and
sense.
so if there's an issue like that going on, we may find a hearing loss, but it's not something that we would ever put a hearing aid on. We would want you to be medically managed by a physician.
Okay.
And there are other medical conditions of the ear that can be treated by physicians rather than hearing aids. Or in some cases, we find out, okay, well, the physician documented that it's not really medically manageable, so then we have to go to hearing aids. But there
Okay.
are steps we like to go through first
Start.
before just sticking a hearing aid on everyone's ears.
That's good to know, that someone doesn't have to worry about the fact that they're just going to come in and see you and automatically get, here you go. You need a hearing
Absolutely,
aid.
yeah.
They can
And
look at
even
all the
if someone has
options.
a hearing loss, they might not be a candidate because we can only expect hearing aids to do so much.
Right.
And so if it's a very minimal hearing loss or the person is not experiencing any difficulty, then they might not be a candidate.
Okay.
And so we don't just recommend them for everybody.
Sure. Now, you talked about there's different types, so there are still bigger ones. This is a really pretty little aesthetic one, but they
Yes.
have bigger ones, and is that determined by the level of hearing loss? You need a bigger one if you have a worse?
That's a good question. There are several things that would predict the size, and for some of the different hearing aid manufacturers, the larger devices also happen to be the power devices.
Oh, okay.
But in some other manufacturers, the power devices are housed in the same body, so they would look the same as the non-power devices.
Oh.
And it really just depends on the manufacturer.
It is amazing what they do with technology nowadays. When you
Yes.
think about it. Well, it's kind of like cell phones. I remember the first cell phones. I'm dating myself, but they were huge compared to what these little things are now that we can
Yes.
carry around in our pocket. So it's basically the same kind of thing with the hearing aids. It went from the giant
Yeah, all the
to
way
now
down.
these little teeny things that you
Yeah.
can't even tell they're there. I would think most of the time people wouldn't even know that you had a hearing aid.
The very discreet ones, yeah, most people would never even know you had them on until you told them.
Okay, well, we're going to take a break. This is very cool, and we'll be back after these messages, if these little guys ever stay on their stand, and talk more, okay? So stay tuned. We'll be back right after these messages. Don't go away. Welcome back to Your Health Matters. My guest today is Dr. Katie Brown. Thanks again for being here, Katie.
You're welcome.
Now, you grew up in Kingman,
I
right?
did, yes.
And were a tennis player.
I was.
So how did you get into hearing?
You know, it's a funny story. My mom suggested when I went to college, I went to Northern Arizona University, she suggested that I major in speech language pathology. I thought that was a silly idea at the time. I don't know why. But I started with journalism. I ended up in speech language pathology.
Oh,
Moms
okay.
are always right. And for that major, we had to take a couple audiology classes.
Oh.
And I really liked it.
Uh-huh.
And so I applied to graduate school for my doctorate in audiology, and I got in and thought, hey, it's meant to be.
Right.
So here I am.
And you're back in Kingman. That's so cool.
I am. I'm very glad to be back.
And you're back with a husband and a new baby on the way.
Baby on the way, due
got
in
a-
August.
Oh, that's so exciting. And it's a little boy. You told me already. You
It
got
is.
your name picked out.
Yeah.
Lucas?
We're naming him Lucas. We're very excited.
Oh, that's awesome. So hearing, and this is a brand new program here at Kingman Regional.
Yes.
And when we talked about it when you were on the show before, that you were the first audiologist that we had here
Mm-hmm.
at KRMC, and now we were talking about this another new service,
Mm-hmm.
because in addition to that hearing testing, now you're actually able to provide the hearing aids.
That's correct.
So it's kind of a one-stop shop.
It
basically.
absolutely is. Yep. So we can get through the diagnostic process, the hearing aid consultation. We can do the hearing aid fitting and all the follow-up care that you need.
Wow.
So you really won't ever need to go somewhere else.
Because in the past, they could get their hearing tested, usually, and not even before we had it here in KRMC. They would go somewhere else, get their hearing tested, and then have to go somewhere else to get fitted, right, for a
Exactly.
hearing aid. And
Yep.
that whole long process. So you've definitely added a huge benefit for those of us. I say us because my husband occasionally tells me that I need to get my hearing checked, so maybe I'll be coming to see you. I call it selective hearing, though.
Yeah, it can be a little of both. But yeah, it's a great service to be providing to the community, and I'm very happy to be finally able to provide hearing aid services.
That's great. Now, we talked about earlier in the show that there's a wide range of types of hearing aids, so that means there's probably a wide range of pricing.
That's correct.
Okay.
And pricing for hearing aids is not dependent on usually the size or the style. It's more dependent on the level of technology. So just like I always relate it to cars, you could get a Lamborghini or you could get a Geo Metro.
Okay.
The price will be a little different.
Or a lot different, right? Yeah.
And the convenience and the luxury of it will be a lot different.
Okay.
Hearing aids are the exact same way. So there are budget level devices that can do your basic quiet environments. You'll hear better on the phone and in one-on-one situations. And then there are those sophisticated devices that can function in almost any of the complex environments that people can be exposed to.
Okay.
And so that difference in technology level is also difference in pricing. And so every hearing aid manufacturer has hearing aids that are from the budget level all the way up to the premium level.
So a person really can sit down with you and kind of have a discussion about their lifestyle, where their issues lie, what they are looking for and need, and then that in turn will help determine which hearing aid and which price range.
Exactly. So we have to actually go through the whole process. People ask me all the time, well, what are they going to cost?
Right.
Well, we have to go through the consultation process
Sure.
because I can't just look at you and say they'll cost this much money.
Right.
Because I need to know a
You
lot.
need a Lamborghini.
Yeah. Because I need to know a lot more about the person and their lifestyle. We're not fitting a hearing loss. We're fitting a person and their lifestyle.
The real
And so
the
there's
whole person.
there's a lot that goes into it that isn't just what you can and can't hear.
Okay, so I had no idea. Every time I do this show, I say this all the time. I learn something new.
Well, good.
Someday I'm going to be so smart. So, again, we talked about that a person needs a referral. They're going to
Yes.
go to their primary care or their ear, nose, and throat, like Dr. Ramirez here in town, that they would see first, and he then would refer them to you
That's
for
correct.
the hearing testing and then for the fitting of the hearing aid and that whole process. And your office is in the Medical Professional Center, right?
Our front office is actually in the Deli Webb Wellness and Rehabilitation Center. So that's
Okay.
where our patients would come for an appointment.
Okay.
And then we end up walking a little ways but to get to my office. But yeah,
Okay.
so we actually are housed within the Wellness Center.
Okay, very good. So that's a good, and is there a number that they should call if they have questions?
If you have questions, people can call 928-681-8717.
8717.
Yeah.
Okay. So
Or they can call the main hospital line and ask for audiology, and they'll get
they
sent
can
over to
transfer
us.
them.
Absolutely.
So now, how many people work with you in audiology now?
Yep, so it's me, and I have an office clerk who's more like an office manager who handles all of the office side of things, that collects the referrals, and then we also have an admitting person, just like every other department in the hospital, that gets the insurance information for the diagnostic testing. And so it's a small team. There are a lot of other people that work in the office,
Sure.
but there are a few main people that help us on a day-to-day basis, and we couldn't do it without them.
Right. Well, and so the diagnostic portion is usually covered by insurance.
That's correct.
So that's
Diagnostic
good.
testing is almost always covered by
Okay.
insurance. You may have a copay.
Right, right. Yeah,
but
most insurances do that.
That's
but,
correct.
Yeah.
And in regard to hearing aids, most insurances do not pay for hearing aids.
Oh,
And so
okay.
that's something that is important for people to know before they come in if they are interested in hearing aids.
Okay.
I know for a fact Medicare does not cover hearing aids.
Isn't that
and,
amazing?
And a lot of other insurances don't as well. So
That always, I mean, it doesn't surprise me anymore, but you do kind of think that there would be, especially when, I mean, hearing loss is pretty important.
yes.
I mean, really, I don't even think you're supposed to drive if you can't hear, right?
There are certain regulations in that
Yeah.
regard, but yeah, it can be a big impact on your lifestyle. And you know, if I worked for Medicare, maybe we could get it changed. But
Write your congressman or your governor. You know.
I don't see it changing in the
No,
future.
Not
And
the way things are going right now. Probably not. But so you do, again, that's why it's nice to have those options of a price range to pick from.
Absolutely.
So you were pretty instrumental in getting that whole program here, because we didn't have any of that before.
That's true. It was a lot of work. It was a labor of love. My passion has always been, since I got in audiology, has always been fitting and dispensing hearing aids, because that's the part where I get to build relationships with people, and I get to see them, you know, every month or every few months, and we get to have a very long-standing relationship. We get to know each other like family. And so with diagnostics, I see someone one time and I never see them again. But with the hearing aid stuff, it's really building relationships.
Because they come back then?
They come back for follow-up appointments for annual hearing testing, so that we can adjust the hearing aids. And so as long as they have the hearing aids, they'll have to have a relationship with me. So I guess.
And when you see them at Safeway, you know you can say hi and they'll hear you.
Exactly.
It's one of the things I love about Kingman, that we can run into our friends and coworkers and patients. And
that's correct. All over the place.
Yeah, whether it's at the theater, I'm always standing in line at the theater. Oh, hi, how you doing? Or Walmart or Safeway, you're always running into each other.
Yeah.
So that is good. So it's great to have that and those benefits that you brought to us, Kate.
Well, I'm glad to be here. I'm glad to be providing it.
I'm proud of you. You've done some awesome things, especially, like I said, you were a Kingman girl and you grew up and did all this other stuff. Now tennis, we didn't go into that too much. I don't know if you want to talk about your tennis career as well.
Oh, well, in high school, I was on the tennis team. I thought I should get into sports. I was in the marching band. I played the trumpet, and so I thought I'd do something in the season that marching band was not. So marching band was fall, so I needed something for the spring. I decided to try tennis. I had never been really sporty. And I started at the bottom of the ladder, and I ended up, when I was in my senior year, I was on varsity tennis. I can't play now at all. And
well, especially when you're pregnant, that's a little hard to get the...
And my tennis buddy, my husband, is just awful. So.
Oh, well, that's good. It's good to have someone that's worse than you, so you can always beat him then, right?
Yes, yes. If it even gets as far as him hitting the ball back.
That's too funny. So obviously you didn't meet over tennis.
We did not, no.
Now, did he go to NAU? Is that where you said?
No, he did not. He was in the military, and we met on MySpace. Which is
really?
Kind of silly.
That's not silly. That's cool. A lot more people are doing that nowadays.
Yeah.
Because you kind of have a chance to figure out if they're kind of fit your requirements or not before you actually meet them in person.
Yeah, because you can read about them and kind of get to know their personality beforehand. But
and how long have you been married now?
We've been married 3.5 years.
Oh, that's pretty cool. That's like a little poster child for online dating, right?
Yes. Although MySpace is gone by the wayside now.
Right now it's Facebook and Twitter, and there's always new things.
Yeah.
But that's really cool. And does he like Kingman?
He does.
Good.
He lived here for a little bit and worked for the police department.
Oh, okay.
And so he loves Kingman as much as I do.
Good. And what's he doing now?
He's a police officer for Kingman Police Department.
Oh, he is. Okay.
Yep. Yeah, so he was a dispatcher before, and then he moved away, went to the Army, and now he's back as a police officer.
Very good. So he's keeping us safe.
He's keeping us safe. That's correct.
You help us here, and he keeps us safe. What a team. So is there anything else that you want to share with us about the hearing loss or the programs you're doing?
I think it's important for people to know that even if you have no intention of ever buying hearing aids, that it's really important to document a hearing loss if you feel like you are having difficulty. Just like if you have vision loss, we want to document it, because if all of a sudden you have a sudden hearing loss, or you feel like you're having increased difficulty, it's something that we will have no record of if we never saw you before. And so we need to get a baseline. We usually recommend at the age of 50 that we get a baseline hearing test done, so that we can compare for future hearing tests that we may do to see if there have been any changes. And it's also
I'm about 10 years overdue then.
Yeah, you need to talk to your doctor.
Okay.
But then it's also important to realize for a lot of people that you might not know you have a hearing loss.
And it sneaks up on you.
It does sneak up on you. And if you think everyone's mumbling, everyone else is not the problem. So you might have a hearing loss that we need to evaluate.
Well, that's good to know. Good advice.
Yes.
Katie, thank you for being on the show again.
Yep.
Dr. Brown, we've learned a lot from you today. And I hope you'll stay tuned for next week. We'll have another great guest on the program. Talk to you later.